My name is Julie Kaplow, and I'm a licensed clinical psychologist and also an assistant professor in the Department of Psychiatry here, and also an adjunct assistant professor in the Department of Psychology at the University of Michigan. We are involved in a study that is being supported by the National Institute of Mental Health and also in partnership with the Gilda's Club of Grand Rapids. That is a longitudinal study of bereaved children between the ages of 3 and 12 who had lost a parent within the last 6 months. And the goal of the study is to really better understand how kids grieve, what does normal bereavement look like versus pathological grief, and again, what are the risk and protective factors associated with certain mental health outcomes in those children, such as depression or post-traumatic stress. That study, the hope is that that study would form the basis for an intervention that targets children who have lost a parent. The other study that we just are starting now is a study that examines children who have a parent with cancer. This is actually a direct result of really being interested in what our bereaved children are saying to us. And one of the things we're finding is that they're saying that the hardest part for them was not the death itself, but it was actually the events leading up to the death. So things like watching a parent go through a very invasive medical procedure, having a lot of ambiguity or confusion around the parent's prognosis. Those things seem to be particularly stressful and anxiety-provoking for kids. So the current study is really helping us to identify what helps children to cope in the face of having a parent with cancer. This is actually a very overlooked group of children, so they're often overlooked in medical center settings because they're often shielded from having to come into the hospital. They're also overlooked by overwhelmed parents who are having a lot of stress around the diagnosis themselves, but who also have a lot of confusion around how to talk to kids about cancer. So we're really hoping that this study is also going to help us determine what is the most effective way that medical practitioners or parents can talk to kids about cancer and to help prevent the excessive stress and anxiety that is often accompanied by learning about a parent who has cancer.